Hi, everyone. This is Dr. Shahin Ghadir with HRC in Beverly Hills and on the West Side. Thank you so much for joining us. I'm really excited that we have so many people that have joined this webinar tonight. So welcome. Thanks for spending an hour of your evening with me. And we are going to make sure by the time you are done watching this webinar that you are very well educated on all aspects of how to attack your fertility, and you're eligible for a very generous special to do a consultation and allow us to help you move forward with whatever your fertility desires may be. So on that note, I'm going to go ahead and get started. I am Shahin Ghadir. I am one of the fertility specialists at HRC Fertility that is part of the Keck School of Medicine at USC. Okay, so just wanted to let you guys know that HRC Fertility was established in 1988. That's 35 years ago. We have now actually, that slide needs to be updated. We are currently 28 physicians in the Southern California area, anywhere from Pasadena down to San Diego. And we are now in Beverly Hills as well. And next year, we will be opening our flagship location in the heart of Beverly Hills, which we are very excited about. It's going to be one of the largest fertility centers in the West Coast of the United States. We take a lot of pride in offering individualized care for all of our patients and having wonderful service. And that is something that we have worked very hard to get everyone on this page. And we also offer fertility services to people from around the world. So one of the things that I think is really important to talk about is discussing the issues that about 40% of fertility comes from the male factor, 40% comes from the female factor, and there's another 20% that we actually just don't know where it's coming from. As a result of that, one of the first things that we like to do for the male, which is a very easy aspect, is to do a semen analysis. While we do a semen analysis, we're checking for a sperm count, which is called concentration. We also look to see how well the swimmer's swimming. It's called motility. And then the shape of the sperm, the head, the neck, and the tail, we actually look at that and we call that morphology. So that's how normal the sperm looks. We also do a volume count. And all of these things are really important. And if we need to even go deeper, we actually do oxidative DNA damage testing, which is called a sperm chromatin structure assay. The big thing with sperm is that if sperm is not the best, when doing fertility treatments like IVF, we're able to do an additional step, which is called intracytoplasmic sperm injection, or ICSI. And ICSI allows us to insert the best looking sperm we can find. So even if you have like 1% good sperm, we're able to look under the microscope, find that amazing sperm, and inject it into the egg. And that's what helps people with low sperm counts or poor motility or poor morphology able to proceed and do really, really well. So the basic evaluation of the man involves the sperm analysis. We also recommend doing preconceptional genetic testing, which checks people for about 400 different disorders these days. And these are disorders that you may carry in your blood, but you're never going to have. But if you and your partner both carry the same disorder from the egg and the sperm side, and the problem is that you can then give the disorder to the child. So these are things that we check beforehand. And if a male and a female, or a sperm and an egg, both carry the same disorder, we are able to do special testing called single gene mutation testing, which allows us to make sure that the diseased, the one that got both from mother and father, is no longer transferred in an embryo transfer back into the uterus. So we only put back healthy embryos. Additionally, infectious disease testing is very important. And we always do that as well for all women that are and men that are proceeding with all fertility treatments. So this is actually a picture of the intracytoplasmic sperm injection process called ICSI. We take the egg, we stabilize it with something that holds it in place, and on the other side, there's a special hollow needle that has picked up the best looking sperm. The needle goes right into the egg, delivers that one beautiful sperm, and comes out, and then we hope that fertilization will occur. Now, the evaluation of the female is just a little bit more complicated than giving a quick sperm sample for an evaluation. One of the first things we like to do when people are not getting pregnant is to do an evaluation of the uterus. It is called a hysterosalpingogram, where we put a special little catheter, and I'm licensed and do this procedure in our clinic, but I'm licensed to put this little catheter into the uterus, and then we push the dye, and the dye comes out from both fallopian tubes, and that tells us if it's normal. You can see in this picture that one of the fallopian tubes, the dye has come out and spilling down, but the other one is just filling and filling and filling like a balloon and is not open. And that's what's called a hydrosalpinx. And those fallopian tubes, first of all, don't let people get pregnant. Second of all, they actually can reduce pregnancy rates, and they are just unnecessary to keep a damaged fallopian tube like that. So once we're done doing the fallopian tube test in the uterus, there are hormones that we check, and there are testing that we do on women to allow us to know how fertile they are. One of the things that we do is that we can see that as women get older, the abnormal numbers of eggs and the abnormalities that come along with eggs increase and increase. So it's really important to try to do whatever you're trying to do with fertility earlier. The younger you are, the healthier your eggs. The older you get, there's a rapid decline in quantity and quality, which means the genetics of the egg become bad and lead to embryos that are not healthy. So this is why we like to recommend doing genetic testing when we are doing fertility treatments. So this is a slide that is showing how we do ovarian testing. I'm sorry it's a little blurry, but the number one test that we do that's called the egg reserve blood test is called the AMH, or anti-Mullerian hormone. Anti-Mullerian hormone is the hormone that is released from the eggs in your body. So when we do the blood test, if the level comes up high, you have a lot of eggs. If the level comes up really high, you probably may have polycystic ovary syndrome. And if the level is really low, it means you have diminished ovarian reserve. It's the number one predictor of your fertility. It could be done on any time of the month. It does not matter where you are at all in your month. And also, it could be done even if you're taking birth control or any other birth control. So this is one of the most important tests that we do for people when we're moving forward with fertility. So the basic evaluation of the female starts with egg health and checking the ovarian reserve blood test, a pelvic ultrasound that also looks at the ovary, because by looking at the ovary, we're able to count these little bubbles. They are called antral follicles, and that tells us if the ovary looks healthy and has a lot of them, or if the ovary looks like it doesn't have a lot of them and is aged with very low ovarian reserve and a low antral follicle count. We also do additional hormonal testing like thyroid and prolactin and things that directly and indirectly affect your fertility. And like I said, the uterine evaluation and the preconceptional genetics testing that we do both on males and females. We also check some basic tests like vitamin D, a complete blood count called a CBC, the TSH for the thyroid, and also to check your immunity status for chickenpox and measles, which are varicella and rubella. So, one of the most common things that we do when we're treating fertility patients, if we're not doing artificial insemination, which means taking the sperm and washing it up and putting it inside the uterus at the right time of the month, it's the next step of treatment, which is called in vitro fertilization. The word in vitro means outside of the human body, and fertilization is when we put the egg and the sperm together to fertilize. So it's basically fertilizing the sperm and the egg in an incubator outside the body. And how do we do this? We do this by giving patients medications for about 10 to 12 days to grow a bunch of eggs. And as a result, this is a better slide. We then grow embryos that can be genetically tested and are healthy. We put those embryos in a reserve for all your kids, and we can put the embryos back one at a time, or even sometimes two at a time if we've discussed it and we make a decision that that's the right decision. And then we do what's called the frozen embryo transfer. So in this photo, you can see that the first thing we do is the egg retrieval procedure. It's about a 5 to 15-minute procedure where we put a patient under a light sedation that involves giving an IV. And in the IV, my anesthesiology team gives a little bit of sedation. You fall asleep, and then an ultrasound is placed, which has a little needle at the tip. It goes right through the vaginal wall into the ovary and helps us retrieve the eggs that grow that month. It takes about 10 to 12 days of injections and about 3 or 4 ultrasounds before we get to the egg retrieval time. And those eggs that come out the day of the egg retrieval are then introduced to sperm to fertilize and grow. And as you can look at these pictures, day 1, day 2, day 3, there are more and more cells growing on an embryo. And by the time it gets to about day 5 or 6, it is a full-grown embryo called the blastocyst that makes it eligible for a biopsy and then freezing it, which is called cryopreservation. If you're doing egg freezing, day 1, when we look at the eggs, we evaluate which eggs are mature, which eggs are not, and those are the ones that are going to be frozen. All the mature eggs get frozen for you to use in the future in case you need to use them. Now, when you get to that last stage and we've done that little biopsy, the testing we do on the embryos is called pre-implantation genetic testing, PGT. This is a very, very important test that allows us to know which embryos are healthy and which are not. It also lets you know the gender. And in the United States, we are absolutely allowed to discuss that. It also eliminates all other chromosomal problems, such as Down syndrome, which has an extra chromosome 21. It also, by doing this, eliminates diseases that are specific to you and a partner when both of you carry it. The single gene mutation testing I was referring to earlier is also known as PGTM, and it allows us to have higher pregnancy rates and lower miscarriage rates. All of these things improve pregnancy outcomes, and it actually is a cost saving because it allows us to be more accurate in finding the best pregnancies possible. So once we have those healthy embryos that are genetically normal, we can prepare an embryo transfer. 99% of our embryo transfers occur on a frozen embryo transfer when we have a beautiful embryo and we prepare the uterus and we put the embryo back. The process is usually a couple minutes long. The patient is completely awake with no anesthesia. There's a tiny catheter that is painless that goes up into the uterus. And as it goes up into the uterus, we kind of release the embryo and it goes right into the uterus. And 10 days later, we know if the patient is pregnant. What happens in this slide, it shows us the quality and the outcome of pregnancy rates when doing pre-implantation genetic testing versus no pre-implantation genetic testing. And it shows that people that do PGS, the pre-implantation genetic screening, have a much higher chance of pregnancy outcome versus the people that do not do the genetic testing and put an embryo back blind. Embryo cryopreservation is also the process of keeping embryos frozen for future use. So whether you make 5 embryos and you put one back the following month and get pregnant, the other 4 get frozen for future children, or if you are a young couple that knows you want to have kids, but not right now, and for a later time, we're able to freeze those embryos as well. So historically, it's associated with higher pregnancy rates, and it's the gold standard for preserving your fertility when using an egg and a sperm, okay? And our success rates these days have hit as high as almost 80% success, which is wonderful. And it's one of the highest in the entire country. One of the things this also allows us to do is freeze only high quality embryos. So you have a great success when you come back to use it. And thawing of the embryos does extremely well these days, which almost close to 100%, which is like 98% success rate. So let's talk a little bit about just the egg freezing process. This is an important step for people that are beginning to have a poor ovarian reserve, which means low egg reserve. For any single woman who is ready to proceed, it says here women in their 30s, but I have to be very honest. We are now getting women who are very proactive and very smart and are doing this in their 20s. But my cutoff is once you hit 30, if you are not ready to have a child and you don't want to have many other kids in the future, you don't have to do it. But at 30, it's recommended to freeze your eggs. That is the number that is kind of, for me, if you haven't done it by 30, everyone needs to do it. Also, couples that are undergoing IVF who are opposed to creating embryos, we give them this option to freeze the eggs for future use. Now, there are many questions that I get about how many eggs should I have, but it kind of depends on the patient. Do you want to have 4 kids or do you want to have 1 kid? There are lots of studies that have shown that about 20 eggs is needed to get a successful pregnancy. I have had a patient that made 2 eggs and had 2 beautiful kids, but I've also had patients that made 30 eggs and unfortunately were unable, because of egg quality, to have a successful pregnancy. So I think it's extremely important to get as many eggs as you possibly can in a healthy manner at a good age to use in the future when needed. So third-party parenting is also something that we do all the time. It's the process where someone needs to use either an egg donor, a sperm donor, or a surrogate. That's why it's a third party, an additional person helping out. When we are doing screening processes for people that are using egg donors, we psychologically screen those donors. We do very thorough medical histories and examinations, family histories, laboratory evaluations. We do general testing. We do infectious disease, STD testing. We do all kinds of drug screens, which are toxicology screenings, and genetic screenings are incredibly important as well, and ultrasounds, and of course, legal contracts to protect everyone. When screening a surrogate, we do psychological screening. We make sure they're completely stable and know exactly what they're doing. We also get reviews from maternal fetal medicine specialists, which are high-risk specialists. We also do medical histories on the patients. We meet them, we talk to them, we look at their prior histories of pregnancies and how they did. We also do screening tests on them, lots of toxicology screening and infectious disease testing, which is all really, really important. Of course, we check their uterus and make sure that their uterus is perfect and looks like it can do extremely well. And we also do legal contracts, again, to protect everyone involved. So for our lesbian couples, there's lots of options. We can take donor sperm or sperm of a known donor, someone that you choose to donate to you. We can do artificial insemination, or we could do what's a collaborative pregnancy, when the egg comes from one partner and makes an embryo, but the embryo then goes into the other partner. That's called reciprocal IVF, which is something that for me is very special when everyone's very, very involved in the process. It allows both women to be extremely involved and have biological ties to the child. We also do embryo donation and surrogacy, even for our lesbian couples, and it's absolutely, all of this is legal in the United States. When helping our gay male couples, we also help them get surrogates, we help them get eggs, we make their embryos. We can use sperm from one partner or typically both partners. We can make embryos using the same egg for both the sperm partners. And all of this is done in order to make beautiful embryos that are carried in a surrogate and is completely legal in our country. So one of the most important things that we always like to talk about as well is all of those treatments are available, but it all begins with healthy parents making healthy embryos and healthy babies. So eating extremely well, eating a Mediterranean diet, which is one of the most important for me, that has a lot of plant-based, lots of vegetables, and fruit intake is wonderful. I believe in a very well-balanced diet, poultry, fish, maybe meat, but not as much. If it's going to be a meat, a lean meat. I think that it's really important to make sure where you're eating, if you're not eating uncooked foods and unhealthy foods. Also, whole grains are really important. 1 cup of coffee is not a problem a day. You can continue it even when pregnant. And also limiting all kinds of processed foods that come in boxes with expiration dates. Those are my least favorite kinds of foods. And sugar, which is really harmful in this process, and excessive gluten, which isn't helpful as well. So try to be the healthiest you. It's really, really important. Adding also some supplements such as CoQ10 and the dose of 600 milligrams a day is really important for women, 200 milligrams for men. Additionally, being in a normal weight bracket is really important because as weight goes up, fertility goes down. Sleeping well, which has been proven and lately been talked about a lot, is extremely important for our well-being. And that's why we think that sleeping well is important for pregnancy and fertility as well. And making sure that you have a well-balanced life that is not revolving around your fertility. And by meaning, I say that because I think exercising a little is good, things that are good for your meditation and yoga and acupuncture, all these things that calm you down are really good for you overall and important for you. Alcohol is probably just not the right time at all during this time period to be drinking excessive amounts of alcohol. I'd say a glass here or there is perfectly fine. Definitely no smoking or vaping, and taking a good prenatal vitamin and folic acid is important, making sure that all your vaccines are updated, and doing your annual checkup with your general doctor, just making sure you are not missing anything at all. So this is some of the things that I talked about in the beginning, how HRC has been around for 35 years. We have multiple embryologists in our institution that are some of the top in the country. We're very happy about that. We have pioneered many things at our clinic with big studies and big healthcare initiatives and studies that we've done that have revolutionized the care in the fertility world and also helped us learn a lot about the things that we do now, such as genetic testing on embryos. We are extremely patient-focused. My staff here in the Beverly Hills office is extremely caring, and I adore them. They have been a wonderful group to work with, and I'm so proud of them. And we are very, very happy that we have a lot of different programs that offer wonderful, wonderful specials for our patients. Our newest location that we moved into this week is in Beverly Hills on the corner of Wilshire and Lapeer. This is our office phone number and also the email to my team. And if we can be of any assistance to any of you guys, feel free to reach out to us. Just another thing, if anyone is into social media, the Dr. Shahin Ghadir channels, which are the handle DR for Dr. Shahin Ghadir. So it's at Dr. Shahin Ghadir on Instagram, on TikTok, and on Facebook. I put things out almost every single day to try to help people that are wanting to learn and improve their fertility. I also have a podcast called The Fertile Life, and it's out there if you Google The Fertile Life by Dr. Ghadir. We've talked about amazing, important topics, and I've had some lovely guests that have talked about their journeys, and I think it's a lot of fun if any of that interests you. But with that note, I would love to jump to our questions and see if I could answer any of the questions for you. I am going to go right now to our chat. Okay, so I'm going to try to answer as many as I can, and feel free to type in your questions in the chat and we'll go from there. Okay. Okay, so let me just try to go through them. So let's start off with this question that had to do with the supplements. There are a few supplements that I recommend to everyone. One of them I briefly touched on. It's called CoQ10. It's an antioxidant. Women are supposed to take 600 milligrams of CoQ10. Men are supposed to take 200 milligrams. I think a very good prenatal vitamin and also an omega-3, a DHA that comes from plants, not from fish oil, is also recommended. And making sure that your vitamin D level is normal, or taking at least 2,000 IUs of vitamin D are the basic beginning points of where I start with supplements. So again, the question was CoQ10. For women, it's 600 milligram, and for men, it is 200 milligrams. But I really appreciate this question because it says, for how long before egg freezing should we take it? So this is not something you need to take before egg freezing. So if you waited 6 months to take it, guess what? Your eggs will age 6 months. But what is beneficial is that if you are on it, it slows down the aging. I do not ever postpone any cycle for my patients to give them supplements. But these are important things that I think you should be taking on a regular basis in order to help a female body slow down the aging of their eggs and maintain all the supplements important for future fertility. That's how you should look at it, not for a time period before. So the question was, what factors go into deciding whether to start with IUI versus proceeding to IVF in a single woman using a sperm donor? Very good question. And I think a lot of that has to do with the female's AMH level. If you want to have future kids as well after the first child, how old you are, how fertile you are, and also if you're okay with successes of IUI that may be between 10 to 15% versus IVF that's 70 to 80%. So it's a very specific question for different people. And these are the kind of questions that we love to answer when we do individualized consultations one-on-one.
Have someone saying that they can't hear you? Maybe do a little check.
Can everyone hear me is the question, because someone said they can't hear me. So it seems like a lot of you can hear me because we've gotten a lot of questions. But I feel bad for the person that did not hear this, but this will be saved and it will be put on a channel that you can watch in the future. And hopefully the speaker will be working, and I feel bad that you didn't, but I am so sorry. Okay, so next question. I appreciate the comment that this was so great. I enjoyed doing it. So thank you for giving me your time. Okay. What's the best brand of supplements outside of going to the MDR pharmacy? I like the ones from the MDR pharmacy a lot. A lot of patients have really given me positive feedback, but I also love a brand called Encapsulations. I think they do a really good brand. Unfortunately, they're very expensive. So the next question, for women over 40, how many rounds of egg freezing do you recommend? And are you able to know the quality of the egg at the time of harvest? So there's never an opportunity to know a quality of an egg until you make an embryo and you do genetic testing on the embryo. You're only able to know if the egg is mature or immature. All the mature eggs get frozen. I think that if you're over the age of 40, you should try to do as many that you can do to get a good number of eggs. And this is a discussion between you and your doctor, because it depends again. Do you want to have one child, or is your goal 4 kids? And these are important things, but I think getting as many eggs as you can in a timely manner is probably the smartest way that I would represent that. Okay, I'm glad a lot of people can hear me. Are AMH levels an accurate predictor of the number of eggs that will be retrieved? Well, I think there is no better test than an AMH level. I have been surprised when people got sometimes a lot more eggs than I thought, and some people got less eggs than I thought. But it all depends also on the body. The AMH is a good predictor that gives me a generalized amount of what I think I'm going to get. But some people's bodies respond really well to the medicine, and some people's do not. And that's where the difference becomes. Okay, so next question. If I already tested an AMH, and it is 0.5, is egg freezing an option? Absolutely. So I'd rather, if it were me, I'd rather have 1 frozen egg than 0 eggs. So if you have a low AMH, you're not going to make 20 eggs. But we have had people that made 1, 2, or 3 eggs at even older ages and were successful. Was every single person that made 1 or 2 or 3 eggs successful? No, but many people have been. I'd rather be in the game. I would rather do what I can now rather than have 0 option of a child later on in my life. As long as AMH is in the normal range, is that good? Or should it be in the higher normal range? So first of all, there's nothing, whether if your number is in the normal range, it's in the normal range. There's nothing you can do ever to increase your AMH level. So if anyone tells you that, they're lying. You do not make more eggs. Your AMH is your AMH. So I think the better way to look at this question is that if you have a reasonable AMH, that's a perfect time to do what it is that you need to do, and waiting will only harm you. So I love this question. It says that all of this is a little intense and scary, also exciting. How do you stay emotionally grounded during this process? So it's hard to see, but behind me are pictures of my family, and it's really hard to see. But I have four kids. After my first child was born, my wife and I got pregnant for our second and actually had a miscarriage and didn't get pregnant for over 2 years. So we did 6 months of artificial insemination, even though I don't recommend 6 months ever, because my wife was not even 30 and it didn't work. So we had to do IVF, and we decided that we will put two embryos back, and we have now twins that are 12 years old, a boy and a girl. And our fourth kid was a surprise out of nowhere. She's 7, and she is the best thing that ever happened to us. But all of this, I can tell you, for everyone, whether it was me as a fertility specialist or you who doesn't know much about fertility or is very scared about this, is overwhelming. That's why you need to surround yourself by people that care about you, that you could talk to. And if you don't have that, then a therapist that you trust, an acupuncturist that's amazing and calms you down, and things that you could do on your own for free, like meditation, like walks, when you go out and take just some time for yourself and remind yourself how beautiful this world is and how lucky you are to be able to walk around and kind of just ground yourself. This is important. Guys, this is so important that you cannot allow your fertility issues to take over your life. You need to make a plan. You need to have a good doctor that you trust and a team that loves you back and will do anything to make this happen for you. But it is very important not to get lost in this process. So thank you so much for asking that question. There's questions about the costs, and I actually don't talk about the costs. At the end of this, you're going to be given a link that you can get a special price to do a consultation that is, I think, less than 1/3, almost 1/4 of the price almost of the consultation. And at that point, after your consultation, we have financial planners that can help go over everything and give you all of our specials, let you know what you qualify, check your insurance, and make sure that if it's covered or not, and help you with all of that. So next question is, I have high sperm count, but a very low motility count and morphology number. I do have previous children. What can I do? Supplements. So there are male supplements. I do like one called Naturally Smart for Men. It's 6 a day. It has a lot of proteins and amino acids that help sperm well-being. CoQ10, 200 milligrams a day is really good for men and helps with their sperm counts and quality of sperm. But if the sperm count is up to a great number, but the motility is really low and the morphology is really low, you may be a better candidate for doing IVF when we pick the best sperm that you still do have, even though they're low in count, and inject those into the egg. And that will really help you have a great outcome. If you have eggs frozen at 40, should you try to first get pregnant naturally or use the eggs you freeze? So there's no right or wrong to that. It depends. If you are now 46, I wouldn't waste time trying to get pregnant because it's not going to happen. But if you chose to freeze your eggs at 40, but now it's a few months later and you have Mr. Right in your life, yes, why not try for a little bit? And if it doesn't work, you always have those as a backup. If you've done a previous egg retrieval from another clinic, could I use those to do IVF at your clinic? It depends. So we like to see the report from the lab where you did it and make sure it is techniques that we are knowledgeable about and thawing them won't be a problem, and that it came to us from a reputable location so that we're not going to be inheriting some major problems. So the answer is that we possibly can, most likely we can, but we need our lab director to give us an approval before doing so. Says, if you have an AMH of over 4, should you freeze your eggs, or does that mean you should be able to conceive naturally? It doesn't mean anything. It means that you have a decent egg reserve, But if you're 45 years old and you have an AMH of over 4, probably the majority of your eggs are going to be of poor quality, but you still have a lot of them. So I think your age matters a lot. And I do think that having an AMH of 4 is an excellent number, but you have to also look at the age, because quality depends more on age. Quantity depends more on AMH. The fertility therapist, I have a lot that I love. I give them based on getting to know you better. And after a consultation where I think I know who may be a better fit, that's when I make my recommendations. So yes, we do have fertility therapists we recommend because this does become very difficult for people. But I like to do a one-on-one kind of referral to people that I know once I get to know you better. So after egg freezing, what do we offer for patients? That's a really good question. So I bring everyone in usually a day to 3 days after the egg retrieval to do an ultrasound and some blood tests and to see how my patient is doing. As a result of that, when we do that, many of my patients, I tell them you have to continue taking it easy, no sex, no exercise, and I usually bring them back even one time after that. That's the majority of people, and that's how we do the post-op appointment to make sure. And then I will tell you when you can go back to doing everything. Brian, you are welcome. Okay. Because it's moving mine.
Oh, okay.
Okay, 1 second.
Sorry.
No problem. I have a very anxious helper here, and as she's typing, it's moving the questions up and down.
So
No problem. So my wife and I had an embryo passing PGS, but still miscarriage. What's the reason? It was done when my wife was 34 years old. So there could be many reasons. Your wife could have autoimmune disorders that could reject the pregnancy. There could be an abnormality in the uterus that doesn't allow the embryo to implant any further. It could be fibroids. It could be blood clotting disorders. I think there's a lot of investigation to do when someone puts a PGS tested normal embryo and still has a miscarriage. Also, some people's PGS testing is not as accurate or as detailed as other clinics. So you need to find out what level of screening they do. Acupuncture, what are my thoughts on it? I didn't really believe in acupuncture, but now I absolutely love it. When my wife and I had to go into fertility treatments, I decided I was going to go with my wife to acupuncture, and I have now done acupuncture with 2 different people. They're my number 2 referrers because when I walk in there and I walk out of there, I am a new person. I am reset, I am calm, I am relaxed, and I love their energy and what they do. But I also have had patients go to acupuncturists where their goal was to shove products down them and sell them, and they didn't feel comfortable. They hated the process. They were made to feel nervous and uncomfortable. Then I would say acupuncture is not right for that person. So if you have a needle phobia and you're shivering and scared and don't relax, don't do it. It's not worth it. Do meditation instead, or do massage instead. Anything that takes your mind off. But if you do go to someone and they calm you down, they're a good support to you, you feel regenerated and rejuvenated and reset afterwards, it is a great thing to do. And my final question is, I am 42 and looking to start trying to get pregnant naturally. Do you recommend taking hormones while trying to conceive naturally at this age? I also have 7 frozen eggs from the age of 36, but only got 7 after 2 cycles. So I figure getting pregnant naturally will be difficult. So I'm not a huge fan of people at the age of 42 trying on their own naturally to get pregnant, but I can understand because your backup plan of 7 eggs is not that much. So I would give it maybe a few months and see how it goes. I would definitely do an HSG before to make sure your fallopian tubes are washed and cleaned out really well, because after that, for the next 3 months, you have a higher chance of pregnancy. So that will really help you kind of make things the best. I also think maybe using some medications, and they're not hormones, they're pituitary gland stimulants that increase your own natural hormones internally. Those medications potentially could help you release more than 1 egg, and it could give you a higher chance for more targets of eggs for sperm to hit. So I don't think that could hurt you in any way. So I would, if it were me and I was going to give it 3 to 6 months before using my frozen eggs, I would say, sure, by all means, feel free to use the medications as well. And one more popped up, another question. So this will be our last question. We have an embryo PGS showing chromosomal abnormalities, but the doctor said there is still a chance for birth of a healthy baby. Is that true? So there is a condition when there's a partial abnormality mixed with abnormal and normal cells called mosaic. If your embryo maybe has one finding of a mosaic that's not, and that there's a percentage of how mosaic it is, and it's minimally mosaic, like 30, 35%, 40 maximum, and not on multiple chromosomes, but just on one, it could be that when you got pregnant, the body could auto-correct those cells that were slightly abnormal. But if it's completely abnormal, absolutely not. So I hope that helps, and don't run into doing an embryo transfer of an abnormal embryo. And if your doctor is encouraging that, I would highly recommend possibly looking for a new doctor. So I want to thank everyone for joining us. Please do look for your consultation vouchers that are going to help you. Again, we are in our brand new location as of this week, in our Beverly Hills location, which we're going to be here. We're happy to help. I'm beyond thrilled to help anyone who needs help doing this. This is my life and my passion, and I love doing what I do. Thank you so much for spending your time with me. I appreciate it tremendously, and have a wonderful night. Thank you.